There's a blood test that can diagnose heart failure called BNP. Professor Ken MacDonald, who's the clinical lead, the HSE National Clinical Lead for the Heart Failure Programme, has shown that heart failure costs Irish society $660 million per annum, with direct costs to HSE of $147 million. BNP is a test that can diagnose heart failure quickly. When it is available to GPs in rapid access, there has been shown to be a 30% reduction in the need for echo and a 60% reduction in the need for a consultant review, which would tie with other studies where patients who go to heart failure clinics, only 30 to 40% of them end up actually being diagnosed with heart failure, because heart failure can be very difficult to differentiate from COPD or frailty or other illnesses. And just so people know exactly what heart failure is and what it does to patients, it causes chronic fatigue, shortness of breath, anxiety. People feel like they're drowning in their own fluids. A 6-month delayed diagnosis in heart failure leads to a 23% increase in unscheduled hospital admissions, with all their attendant costs. So I think if you look at the back, there's a map which shows access for GPs to natriuretic peptide or BNP testing throughout the country. The green have access, the red don't. So over half the country does not, half the GPs in the country do not have access to BNP testing for their patients, which leads to increased costs and worse outcomes.
So, just summarising, we don't have access to diagnostics, so we are having to refer patients. This is where the bloated waiting lists in the hospitals are coming from. I can't get an MRI. If I refer into orthopaedics, they might be able to get it. So we've got 500,000 people on a waiting list. Maybe once upon a time it was too expensive to get MRIs or CT scans when they were 500 or 600 euros. Now they're 200 euros. So these diagnostics need to be made available to us at the primary care level. They need to be made available for our patients.
Could I just also add that Dr. Niall Sheehy, who is the HSE clinical lead in radiology, did a study in St James's Hospital last year with regard to access to ultrasound, direct access to ultrasound for GPs. There was a 30% pickup rate of pathology. There was reduced attendance or reduced referral of patients to A&E and reduced referral of patients to outpatients. So it just makes sense to give GPs access to diagnostics in the community for their patients.
And just briefly to clarify with regard to the location of those diagnostics, in a strategic locations, is it primary care settings as opposed to, in some areas, maybe the hospital setting could be used as well? But do you feel there would be a conflict there if GPs could?
It must all depend on real-time measured performance. Different combinations could actually work quite well. Historically, our experience with the hospital has been so difficult that we're actually disenchanted with it. So a lot of us do feel, take it out of hospital, put it into separate standalone facilities. We have examples in different general practices of bigger practices. In my own cooperative in KDOC, we have a radiology department in site. So we're not really all that fussy where these diagnostic facilities are located, but they must be made available to the complex comorbid patient quickly.
Thank you.